At the beginning of the pandemic, we were scrambling, trying to pull together the workforce that we needed for case investigation and contact tracing and other mitigation measures. I believe that what we saw in the course of the pandemic was a house that was completely flooded by the pandemic and trying to deal with that pandemic. And essentially, the foundation of public health has been greatly damaged as well. We need a transformation of public health and not just plugging in the holes in the house, but really working on that infrastructure, on that foundation for our essential services. And I would say my top three uh, infrastructure kinds of pillars that need to be rebuilt and built back better are data and technology, our ability to do data analytics, collection, reporting, and visualization. Our workforce, which has really been decimated. We need to really improve our training, and we need to build up the actual numbers of people in the public health workforce. And I think we need to work on our communications infrastructure and public engagement. Those two things together are absolutely critical for any kind of response in the future.